Now, the skeleton can be divided in two areas: the axonal skeleton, which is the middle part, and the appendicular skeleton, which is basically our upper extremities and our lower extremities. This is your head, but your head is composed of multiple different bones. One of them is going to be the frontal bone, as you can see right there. We're going to have the temporal bone, which is going to be this one. If we go over here, we have the temporal bone in there. The pointy, this is going to be called the styloid process. What is this one that is actually big like that? This is going to be the mastoid process. This one right here is going to be the zygomatic process. So, and what is this right here? This is where the hole for our ears, that's going to be called the external acoustic meatus. That right there is this, going towards your face right there. This is the zygomatic bone. This bone right here is going to be the mandible. This bone right here is going to be called the maxilla. This bone right here is going to be the sphenoid bone. This one in purple is going to be the nasal bone. So this is the frontal bone. This is the parietal bone. This is the temporal bone, and this is the occipital bone. We can see here the occipital bone, which I showed you before, is going to be the green bone right here in the back. So basically, you're going to occupy the base of your skull. And in this bone, we have a big hole, is the foramen magnum. On each side of the foramen magnum, you're going to have the occipital condyles. So you also have occipital protuberance, which you can see right here. Occipital protuberance, these are these ones right here. You see these things that you have right there? Okay, but you can clearly see here, there's another bone, this bone right here. This bone is going to be the sphenoid bone. If we scroll down right here, so then this is the sphenoid bone right there. This one is going to be the greater wing, and this one is going to be the lesser wing. This is going to be called the pterygoid process, as you can see right here. Right, this one right here is the body, and in here, there's a little fossa in there. That's going to be called the sella turcica, or dorsum sellae. So if we go to the next one, we look at the front of our face, we can see in there the ethmoid bone. The ethmoid bone is going to be located right here in your nose. This is the nasal bone. Behind the nasal bone, you're going to have the ethmoid bone. Okay, in there, you're going to have the lateral masses. This is what's going to be basically part of your nose. And the middle, what separates your nose from right side to left side is going to be this, which is going to be the perpendicular plate. The top of this bone is going to be a pointy area right here called the crista galli. On each side of the crista galli, you're going to have a plate like this. I'm putting that in red. This plate right here is going to have holes. So therefore, it's going to be called the cruciform plate. The maxilla. So this is the maxilla right here like that. So this area where our upper teeth are, right? So this area right here is going to be the alveolar margin. We're going to have a hole here. The infraorbital foramen is going to be called infra because it's below your orbit. So it's going to be called infraorbital foramen. If we scroll down, we have the mandible. It's where our lower teeth are going to be. And it has different areas. This is going to be the ramus, the angle, the body. This is going to be the mandibular foramen. This one is going to be the notch. This is going to be the condyle. This one is going to be the coronoid process. Right here, we have the hyoid bone. The hyoid bone is located in our neck. The hyoid bone also has parts. This is going to be the body. This part right here is going to be called the greater horn. And this one right here is going to be called the lesser horn. If we look at the frontal bone and the parietal bone, are they connected? Yes. By what? By this joint right here. What is that specific name of this joint? This is going to be a suture. And that's what you see right here. The names of these sutures are going to be the coronal suture is going to be this one right here between the frontal bone and the parietal bone. So this is the coronal suture. Between the parietal bone and the temporal bone, this one right here is going to be the squamous suture right there. The one between the parietal bone and the occipital bone, this one right here, that is going to be the lambdoid suture. And the one that is going to in between the two parietal bones, right? This is one parietal bone, and this is another parietal bone. So in between this one right here is going to be the sagittal suture, sagittal vertebral column. It's called vertebral column because every single bone that you have in here is going to be a vertebrae. All the vertebrae, they're going to have more or less the same characteristics, so they can articulate with each other. So they're going to be like this. The first two vertebrae are going to be somewhat different. The first vertebrae, the one in red, is going to be called the atlas. The second vertebrae is going to be called the axis. This is the first vertebrae called the atlas, as I mentioned before. Okay, as you can see, the atlas is going to have a hole. It's going to be the vertebral foramen. In front, you're going to have anterior tubercle, posterior tubercle, and on the side, you're going to have a process. This process is going to be like that. So therefore, this is going to be a transverse process. Transverse process right here. and transverse process right here. In the transverse process, you're going to have a transverse foramen in the atlas. This is going to be for the blood vessels to take blood to your brain. The second vertebrae is going to be the axis. This is the axis. In the axis, we have the foramen, we have the transverse process, and you're going to have an spinous process. This bony part right here that goes up like this is going to be called the dens or odontoid process. So then if we keep going down then to the next type of vertebrae, we have the cervical vertebrae right here. We're going to have a hole in all the vertebrae, vertebral foramen. We're going to have the transverse process, 1 and 2 right there. We're going to have the spinous process, and we're going to have the body right here. Okay, now you also have the superior articulating facet, which is to articulate with the vertebrae on top, and you have the inferior articulating facet, is to articulate with the vertebrae at the bottom. Thoracic vertebrae, the vertebrae that we have in the thorax. So then what do we have? We have the whole, vertebral foramen, spinous process, transverse process, body, superior articulating facet, inferior articulating facet. If we go to the next vertebrae, which is the lumbar vertebrae, so you're going to have the same thing. Vertebral foramen, transverse process, spinous process, body, superior articulating facet, inferior articulating facet. You see the same thing for all of them. Right? This is the anterior view of the sacrum where you can see tiny holes. So they're going to be called foramina. Since this is the anterior view, this is going to be the anterior sacral foraminus, as you can see right here. Now there's going to be this groove communicating each one of the foraminats. These are going to be the transverse lines or transverse ridges. Now, on this side, you're going to have the ala. And right here, the top is the sacral promontory. In the posterior view of this bone, where you're going to have these little holes, but these ones are going to be the posterior foraminus. You have these bumps. They are going to be the sacral median crest. It has a hole right here. This is going to be the sacral canalis. But this bone is going to be the coccyx. The next bone that we're going to have is going to be the sternum. The top of the sternum is going to be the manubrium. The middle is going to be the body. And the tip is going to be the xiphoid process. Okay, so then we have the clavicle. The clavicle is going to have two ends. As you can see here, there's one end in here, and the other one is going to be in here. So this is going to be called the acromial end, and this is going to be called the sternal end. At the bottom, you can have a conoid tubercle. The ribs, you're going to have a head. You have a head is because you have a neck and a tubercle. Then you have a curved area right here, which is going to be the angle. This part right here is going to be the one that is going to be in contact basically with the sternum using a cartilage. If we scroll down right here, we can see that we have true ribs, false ribs, and floating ribs. The true ribs are considered like that because they have their own individual connection with the sternum. So here's your sternum again. So you have this rib right here coming like this, and it's going to end right there. This is the cartilage. So this rib has its own cartilage connecting it to the sternum. This one has its own cartilage, this one has its own cartilage, and then those are going to be called true ribs. The false ribs are these ones right here, at the bottom, right there. These ones and this one. They're going to be called false because they're going to share that cartilage that connects them to the sternum. You see this one comes over here, like that, but you see this one comes over here, merges in there, and this one also merges in here, and they have one common cartilage connecting them to the sternum. Therefore, they're going to be considered false. And then you have these ones right here at the very bottom that you can see there, they don't connect to the sternum at all. And those are going to be considered floating ribs. True ribs are going to be the first 7 ribs. Then the bottom 4, from basically the 8th to the 12th rib, that's going to be false. And then at the very, very, very bottom, we have 2 basically floating ribs. If we look over here, now we have the scapula now with both views. This one right here is the posterior view. This one right here is the anterior view. As you can see in there in the anterior view, you do not have the spine in here. That's going to be in the posterior view. And we said the top of the spine is going to be right here, the acromion. This acromion is the same thing that you see right here. This is just anterior view. That's the acromion. Below the acromion, I told you you're going to have this cavity, which is going to be the cleidocranial cavity. And on the other side of the acromion, you're going to have the coracoid process, this one right here. This is the spine again. This space that you have on top of the spine is the supraspinous fossa. This space that you have right here below the spine is going to be the infraspinous fossa, and those are in the posterior view. In the anterior view, you're going to have this one, which is going to be called the subscapular fossa. The top is the superior border, the bottom is the inferior angle. The side, you're going to have the lateral border right there. Okay, so then if we look at the humerus, the characteristics that you have in the proximal epiphysis, you're going to have the head, neck, greater tubercle, lesser tubercle, intertubercular sulcus. In the middle, in the diaphysis, you're going to see in there the deltoid tuberosity. This is where the deltoid, the muscle that we have in our shoulder, is going to attach. And in the distal epiphysis, we're going to have 3 fossas. That one is going to be called the olecranon fossa. But in the anterior part, you're going to have 2 fossas, the coronoid fossa and the radial fossa. So the ulna It's going to pivot right here in this part right here. Therefore, this is going to be called the trochlea. And the radius is going to pivot in here in the capitulum. Now, if we go to the other two bones, right, radius and the ulna. So in the ulna, we're going to have that olecranon, the coronoid process. And in between those two, we're going to have in here another area called the trochlear notch. This is going to be in the proximal epiphysis. Distal epiphysis of this ulna, you're going to have right here. This pointy thing right there is going to be the styloid process of your ulna. If you look at the radius, we said the top part of your radius is going to be the head. If you have a head, it's because this part right here is going to be the neck. And you're going to have in here this bump right there. That one is going to be called the radial tuberosity. So these are the structures that you have in your proximal epiphysis. In the distal epiphysis of your radius, you're going to have right here another pointy area right there, which is going to be the styloid process of your radius. So then now, these styloid processes that you have right here, they are going to articulate with the bones that you have in your wrist. The bones that you have in your wrist, all the bones, they're going to be called carpal bones, right? You can see right here, carpal bones. They have their own individual name: trapezius, trapezoid, capitate, scaphoid, lunate, pisiform hamate, and tricutum. Then the palm of your hand are going to be these bones right here. And these ones are going to be the metacarpals. You have metacarpal 1, 2, 3, 4, and 5. And the ones in your fingers, they're going to be phalanges. 4 fingers have 3 phalanges, 1, 2, and 3. Because your thumb has only 2, 1 and 2. Right there. So for a total of 14 phalanges, or 28, obviously, in total. So next, we're going to go to the pelvis. And so here, the reason why you have 2 views is because one is for females, the other one is for males. Okay, and as you can see here, this hip bone is being painted with 3 colors. This is the ilium, this is the ischium, and this one is the pubis. So these 3 bones fuse together in order to give us this bone, which is going to be, again, the hip bone, or os coxae. So this bone right here is going to have different areas. This is going to be the iliac crest. Right, this is going to be the anterior superior iliac spine. This is the posterior superior iliac spine. This big cavity right here is going to be the acetabulum. That's what you have right here. So this hole right here is going to be the obturator foramen. That's what you see right here. Okay, so then we have the femur. So this round part right there is going to be the femoral head. If we have a head, it's because we have a neck. Now, after the neck, we're going to have 2 bumps in there. This is going to be the greater trochanter, and this is going to be the lesser trochanter. In the middle of this bone, you're going to have the linea aspera. And in the head, you're going to have a little notch in there called the fovea capitis. You can see right here that you're going to have this other bone right there, which is going to be the patella. The patella is going to articulate with the anterior distal epiphysis of your femur. In the posterior view, you can see here that you have a condyle and you have a condyle. And between those two right there, you're going to have a fossa. That's going to be the intercondylar fossa. If you look at the tibia, it's this bone right here, and this is going to be your fibula. Your tibia has this elevation in here, okay, and this is going to be called the intercondylar eminence. You're going to have in here the medial condyle and the lateral condyle. So in the anterior view, you're going to have this bone right here called the tibial tuberosity. This is in the proximal epiphysis. In the distal epiphysis, you're going to have right here the medial malleolus. Right here, we're going to have the fibula. In the fibula, we're going to have the head and the apex at the very top. In the distal epiphysis of the fibula, we're going to have the lateral malleolus. This part is important because this will articulate with the bones that we have in our foot. So then if we go right here, this is the foot. These bones right here are going to be called tarsals. Bones that are going to form the bulk of your foot are going to be these ones. These are going to be the metatarsals. The ones in our toes are going to be the phalanges. Okay, so then the bones that are considered the tarsals, they are going to form your ankles. They're going to have their own name, obviously. So this one right here is going to be the calcaneus, the talus. You're going to have the medial cuneiform, intermediate cuneiform, lateral cuneiform, navicular. You're going to have cuboid right here, and the talus is right here. Okay, so then in the metatarsals, we're going to have 5, 1, 2, 3, 4, 5. And then we say we're going to have in our toes the phalanges, similar to what we have in our fingers. We're going to have 3 phalanges in these 4 toes for a total of 12 phalanges. And you can see here that in the big toe, we're going to have only 1 and 2. So then for a total of 14 phalanges.